Labor Appropriation Bill.
Minister Mbombo, Minister of Health.
Deputy Speaker, Honorable Premier in absentia, Cabinet colleagues and members of the Provincial Parliament, Chairperson of the Standing Committee, Head of Department and Management of the Department of Health, the citizens of the Western Cape, today I deliver the final budget for this political term for the Health Department. This budget is about maintaining the dignity of the millions of the patients that we serve. We are highlighting the work we have done, but also to show how we work smarter and technically disrupt the space to maintain and preserve the patient's dignity. With this budget, we are all about business unusual to ultimately deliver patient-centered care without compromising the quality. The Department of Health continues to grow, and this is unlikely to change in the short term given the trends in the social determinants of health and well-being. The health sector generally is under severe pressure as a result of the budget cuts, with about 9 billion cuts over the MTEF nationally. The Western Cape Health cumulative budget cuts over the last 3 years at 602 million, and in the next MTEF, current MTEF, at 574, which equates to about 1.2 billion, and that is approximately 6% of the department budget. Over the same period of this MTEF, patients' numbers will have grown, and at the current rate, we might see about 12%. That is not sustainable. Challenges also we have is about urbanization and the in-migration, a burning service platform, drought and water shortages, disease outbreaks and escalating of burden of disease, staff safety. The attacks on the EMS staff is undermining service delivery as staff often are traumatized and put on leave for extended periods. The natural disasters like the fires and load shedding is coming back to haunt us again. This situation places the provincial health system under enormous strain, and in the context of the above, 2019-20 budget year is likely to be a very challenging year. Despite these challenges, the Western Cape has the best health outcomes out of all the provinces. Western Cape citizens enjoy the best care compared to the level of services elsewhere in the country. We have consistently had the life expectancy over the years due to the better population health outcomes, specifically on the lower mortality rates. We have better coverage and access to health services. Where there is no physical facility, we bring services through the mobile or by other means, like public-private partnerships. Access to health services is crucial for where we are going with the universal health coverage. We have made great progress with the universal health coverage feasibility. We will continue to engage to influence national policy. We have initiated inter-provincial collaboration across the KZN and the Eastern Cape with us, where we have already begun to strengthen the health system towards the implementation of the UHC. Madam Deputy Speaker, as you may have noticed, there are no guests in the gallery today. Business is unusual. As I indicated, that we are onto disruption. So we take the disruption of space at all levels. But I want to acknowledge the VIPs, people in the VIP. You will see again that is business unusual. Usually you get the chief of the staff and the senior people. But in the gallery, it's my staff, that is the people who are the behind the scenes. But you are not necessarily recognized. Grant Adams, Umama Mjwaha, UCC osebenzayo phayana, Olivia Daniels, Unati Mainje, plus also Anikwa Cubido. I just want to acknowledge them because people don't know them. So these are my VIPs. So in this budget I'm presenting to you today, we've also presented to the stakeholders, so that's why you don't see the guests here. So we did it another way around, where we present to the people, and then now we're presenting to the legislatures. These stakeholders include our statutory bodies, which is the health recipients themselves through the health committees, the hospital boards, the mental health review board, the Independent Health Committee, Complaints Committee, the District Health Council, the Provincial Consultative Council, the academic, the councillors, health professionals, from community health workers to the senior ones, the specialists, the private health, the business. In 2015, when I presented my first budget, I said nothing about them without them. So that's why this budget is a budget of the people in the true sense. So about 300 people at the time that we hosted were part of it. I want to acknowledge a member, or Reverend Gopi, who was part of the standing committee, who also was there. And I just want to thank her for her invaluable inputs, also on behalf of the standing committee. We took these priorities to them because health is everybody's business. Health is about partnerships. We had representatives from as far as the Beaufort West, the Matsikama, West North Side, alias more than 300 participants who participated. Participants at the AKA, State of the Department Health Address, raised pertinent inputs, which I would like to share some of those. Mama Annelisa from Heideveld Health Committee reminded us about the social ills such as drugs and alcohol and gangsterism that impact on health services, and indicated that there was a dire need to have health and social development integrated approach and budgeting to tackle this. I can assure Mama that as part of the PSG3, which is about increasing wellness and safety and tackle social ills, we have looked at all of these, and currently we're still working involving Department of Cultural Affairs and Sport, Social Development, Community Safety, and well as us in this transversal engagement. The Department of the Premier led the alcohol game changer, which led to interventions that focus on youth as well. Health also contributed to investing in young women, girls, and projects with 80 million rands from the Global Fund to empower young women and girls. Heideveld, which is part of the Klipfontein, is part of this project where we saw over 50,000 young women and girls participated in the last 3 years. Although this project, which also includes actually even the men's dialogue, comes to an end in this financial year as we're funded for 3 years, we want to assure the communities that through whole of society approach WOSA, we'll continue the transversal project with these departments beyond international funding. We are already doing that in Saldanha, where we use our own department funds, where now Saldanha is part of the sites, 4 sites, where we want also to pilot the universal health coverage. The second person that I want to mention is Mr. Anthony Vaughan from Friedenberg Hospital Board, who wanted reassurance related about medical legal claims as they keep on escalating even elsewhere. I can report that the Western Cape has the lowest medical legal claims bill of all 9 provinces. And for us, what is important, it begins with fixing the medical, which is the prefix portion, to avoid the latter, which is the legal claims. Improve the quality so that you can worry less about the rest. I want to thank Dr. Bess and his team for the outstanding work they are doing in this field to ensure we do stick to this promise. The third person, actually there are 2 that I'm putting together, Mr. Mike Hofmeister and Mr. Michael from the Metro, Hofmeister I think from Bishop Levis, raised questions around the construction of the GF Jooste. I can confirm that the Klipfontein Regional Hospital, now no longer going to be a 361 level hospital Jooste, is in the planning phase, and I will elaborate more under the infrastructure sector later. Mr. Wellington from the Maritzburg in Beaufort West raised concerns about the town being the forgotten as in next to the Eastern Cape and also in the Northern Cape, plus also is too far to access health services for the patient, especially for the checkup. I reminded Mr. Wellington, which is now I'm reminding everyone that we go beyond the call of duty and have put in place unofficial arrangements where patients in the far remote rural towns are being picked up from home in areas like the Slang referring the Garden Route, the Haarlem, Avontuur, Durest in the Kanaland, and so forth. And also inclusive of the Central Karoo, Maritzburg, Merweville, and Leeugamka, who are already doing that. As I always say, that geen gemeenskap sal agterlaat word nie. Mr. Swarbeck from the District 6 shared his concern about the negative exaggerated reporting in media that affects staff morale. He urged media to be considerate and not to be one-sided in their reporting. Thanks, Mr. S, as I call him. Indeed, our staff are major building blocks to strengthen the health system. And if one link is weakened unfairly, especially for political score points, you are actually weakening the whole health system. Yes, we are not perfect, we err, sometimes we are wrong and irritate our clients, but we don't dismiss their truth. We investigate, we sit over a cup of coffee, and we apologize. That's why we're the only province with an independent health complaints committee, which is constituted by the skilled people that are not even employed by government to look at those cases where the clients still feel aggrieved despite the interventions. I want to thank Professor Fanison, Advocate Mdludlu, Umama Uros, who are current members of the committee, but I also want to extend the appreciation to the previous ones who served, Advocate Kherim, De Kok, Professor Sinoku Guduma. I want to thank them. The last one, the input, because I'm being selective. Professor Julie from UWC, who raised questions about the training of nursing staff and academic support to strengthen the nursing. I can report to the House that the nursing college and the ambulance college are in the process of getting accredited to be one of the leading higher learning institutions that will provide the best training to future nurses and emergency medical personnel. Watch the space. In terms of the clinical, I just want now just to round off. In terms of the, I want to round off this input. In terms of the clinical committees and hospital boards, because I know if Member Gillon was here, I was going to ask, what did you do after you have passed the legislation in 2016? In addition to appointing all these hospital boards and clinical committee, I can report we have started the training. And so far, we've trained the Westfleer, the Helderberg, the Ladysmith, the Lanesburg, the Otto Duplessis, and Kailicha Hospital, plus also their clinical committees. Deputy Speaker, as I continue this theme of maintaining patient dignity, I also want to start by focusing on 5 key elements that really highlight the length and depth of this department, what we have gone so far to deliver a service despite the challenging environment where we operate. Minister Mutsolet once said that the health services are under distress. Firstly, the Management Efficiency and Alignment Project, MEP. This model of redesign of organizational efficiency and alignment is to make the organization leaner and strengthen the service delivery. Critically, MEP is mainly about changing the way department functions, how teams support a culture of continuous collaboration, learning and growth, and values-driven leadership across the whole system. Ideally, we want to achieve at least a 10% cost saving, which can plow back into other programs to ensure we continue providing a high-quality service. We have concluded the first phase. If you recall that I did mention in my last year's budget speech. So we have concluded the first phase, which involved extensive engagement with staff on the redesign of how we can improve alignment and efficiencies in the management system. The next phase intention is to have now the senior management staff matched and placed within the first quarter of 2019 so that to provide some certainty and stability, especially that now we have done a lot of work at the lower level. The second part is an innovation. I call it #4IR, because it's part of the 4th industrial revolution. I think the Premier did indicate that now if you don't go innovative way, in the current context of where we are general in all governments internationally, it means that you are really left behind. Technology as part of our innovation is key enabler and disruptor in doing business unusual. We have implemented several key initiatives. Firstly, most importantly, to maintain this dignity of the patient that I mentioned earlier. The issue is about the waiting times. We have to reduce these waiting times. And I want to mention a few that related to the waiting times related at the theaters, at the ECs, and the facilities. There are many interventions. The last Indaba we had, we identified about 20 to 21, but I want to flag a few. But I also want to thank all the other facilities and staff who also have contributed to some of the innovations from the cutting edge world operations, orthopedic beds, and so forth. But I just want to mention a few. Last year, I did mention the unique patient identifier, now which has been implemented across the department, including the city services. This allows patients to move from one area of the province to the next, from a hospital to a clinic, and their medical records will still be available on the data system. We are one of the few places globally with an integrated data system across the service platform. Now you don't have to wait longer for your folder. Electronic continuity of care record, stroke, aka e-discharge. It aims to support the patient's journey between hospitals and primary health care through a web-based application. This reduces times patients spend at facilities post-discharge and lay the foundation to establish diagnostic-related groups which assist with a fair resource distribution. Third one, the data center, which allows us to integrate provincial health data which can use to generate actionable information, giving managers a powerful tool for improving healthcare. The potential is incredible, and it is possible to develop tools for most every medical condition. The HECTIS project. This one is particularly crucial in our ECs, where we see the most pressure. This electronic system shows the triage code for every patient, how long they wait, and flag it when an elderly or child is waiting. This continues to support our drive to improve the dignity of vulnerable patients. This has been rolled out already in the Mitchells Plain, Heideveld, the George, the Grooteskier. It follows the patient from the time of entry into the EC unit until the patient leaves the EC. The ultimate purpose is to keep track and movement of the patients throughout the emergency center. I also want to commend the team and work with Dr. Musa Parak, Nadir Fredericks, Mr. Jasmir Maraj. And now the last one that I want to flag, the theater admin projects. In theater, I will find that there's also emergencies like the obstetric, the trauma, orthopedic, internal medicine, and so forth. And theaters are the most expensive unit in a hospital, and also the scarcest resource units. So optimizing theater performance requires good management information, which this initiative is already happening in rural areas, for example, in Worcester. So this is part of the innovation, but we have got also others, a public-private partnership. Remember, we were talking about maintaining the dignity, reducing the waiting times. This is key in our mission to preserve the patient dignity. The department has entered into several partnerships that have allowed to provide access to much health services. For example, the family planning and immunization services, where it has been implemented, and we have formalized partnership with the retail pharmacies like the Discam, the Clicks, and other small pharmacies to improve healthcare services. And now when you go to the mall, whilst you can do shopping, you can go next door and have your contraceptives, and then you immunize your baby. You can check also for the testing and so forth. The other one that I want to flag is the private farm owners, for example, the Detroit groups around the Witzenberg, the Louisville wines in the Matsikama, the Thornland groups in the Swellendam. These private owners have also established access to health services for the agri-workers to ensure a healthy workforce. I visited all these farms personally and saw firsthand how this adds value to the health of the farm workers. I must state that not a cent is coming from us. They built these state-of-the-art clinics, they appoint their own staff, and all of those for us is to give the guidance. Operation 100. This initiative supported Mandela Day and aimed to perform 100 elective surgeries. That is to cut the theater time, the theater slate. Because some people wait even 3 to 5 or 7 years for the knee or the hip operations, for example. The team surprised us and reached 195 for the 2018. This initiative evidenced the commitment to the dignity and care to our vulnerable patients who receive life-changing surgical procedures. These operations were additional to what the department planned and budgeted for the year, but with the help of generous sponsors and donors, we were able to improve the quality of these patients' lives for the better, who were on the department central waiting for the surgeries. And this year, I think we've got additional more. We will showcase. Probably I'll be back. I'll showcase again. Now, the infrastructure, Deputy Speaker, it is one of the building blocks within the health system and forms part of our priorities as a way to address patient experience and service pressure, plus also to maintain the dignity. I'm also proud to announce that we spent the whole of our entire allocation on the infrastructure in the 2018-19. In the past 10 years, we have done a lot. Just to brag. We built 2 district hospitals, 10 emergency centers that were replaced and upgraded, 40 new primary care facilities completed, building of the new 11 ambulance stations, We also prioritize psychiatry units like in Paarl, Vredenburg, and Mitchell's Plain hospitals. In 2018-19, we also have some key projects. District 6, Tembalet 2, College Hospital Ward and CT scan, and a peer clinic, the RAS clinic upgrades, and the 172 million for Vredenburg hospital upgrades. For the financial coming for this year, we have earmarked the following infrastructure, which amounts to about 1.2 billion. The construction of the Hansby Clinic, Lanesberg Clinic, Caledon EMC Communication Center, Victoria Hospital EC, Swartland Hospital EC. Remember, now we've got the site for the hospital, but it takes long, not less than 5 years to build a hospital, but we have to do something with the current arrangement. Helderberg Hospital Observatory for the forensic lab services is underway in the Salt River. The Dorrance Ambulance Station, the Cleeffontein Regional Hospital, which is where in the phase 3, they're all some of the challenges. It was about allocating the site, plus also the business case, which is now we're way far in terms of the advance that by the end of this month, April, we'll be able now to have a community engagement now where we can speak now with the people of the Manenberg and the Gugulet and so forth and talking about the Cleeffontein Regional Hospital to reassure them that it is going to rise. And then in addition to that, of course, the Tigerberg maintenance. Just I want to add that we are not only focusing on the mortar, cement and so forth, but we also have to focus on the water and energy. There have been some of the interventions for the water savings. We also have got the prepared plan. Some will recall at the time of the drought, we invested in the borehole drilling at key facilities, at the Lendeche Hospital, for example, where we have got almost about 10 boreholes that are already there. We do have a water saving plan for all our facilities, just like we have the energy saving plan, plus now with the load shedding in terms of our generators and so forth. So we are prepared. Human resources, I would like to commend our staff for their resilience amidst the challenging circumstances. Our frontline staff is the core of the service delivery, which is why we need to ensure we continue to create an enabling environment for our staff to deliver a high quality services. We survived the fires, we survived the day zeros, we survived the listeriosis, we survived the polka smearing campaigns and so forth. So we want really to thank our staff for such. I would also like to congratulate all our staff who managed to achieve success under these pressurized circumstances. For example, Ms. Patience Shipelana was named as the Democraticness Association of South Africa Most Caring Nurse of the Year in this year. Dr. Delport, who received a great honor after she was recently nominated as the Integrity Idol 2018. What is that? It's a worldwide campaign which was established to give credit to the honest government officials for their work. But I'm just mentioning a few. There are many of those. I mentioned those international and national ones. There are many of those who have received quite a lot of accolades. Deputy Speaker, in my budget last year, I shared that we are the only province that prioritized junior doctors commuted overtime to reduce strength. But there are still more that the national has to do in regard to their overall of the time that the doctors spend. But I just want to indicate that at least we are doing something. There was a time where some of the psychiatric nurses where they work in the psychiatric environments that they didn't have the danger allowance. We introduced that, so they do receive the danger allowance. We received the 135 million that was allocated for human resource capacitation grant, and we have appointed community service medical officers, medical interns, and in the process we are filling critical posts. In addition, I must just add that with the medical interns, we added 204 in the existing ones that we have. So roughly, we have got over 500 of the medical interns that within our system. I also promised there was a time where we had an issue related to the waiting times, the mortuary. We're still talking about the waiting times, where I promised additional staff. So I want to now to share the fact that we have appointed additional specialists, forensic pathology officers, and we have increased the forensic assistant interns from 9 in 2017-18 to 50 in 2018 budget. We have also increased our investment in primary health care. Hence, you'll see the largest slice of the budget is 40% is allocated to district health services. Through this, we have earmarked also an increase in the remuneration for community health workers. We urge communities to support these foot soldiers who are faced with crime and potentially to be mugged and raped in these households. That's why now they cannot go once. They walk distances in rains and suns, dodging stray bullets during their visits. Because at the end, we need these people because the health system doesn't start at the clinic. It starts from the communities. In the communities, we need these health workers. Staff safety remains a concern for the department. Like Saturday evening, yet another EMS vehicle was attacked in Khayelitsha. 2 EMS staff members were robbed at gunpoint and left traumatized. We view criminal attacks on our staff as an extremely serious matter, and a number of measures have been implemented in response. For example, once we launched Operation Khuseleka to raise the awareness and solicit community support for staff safety. Already, we are part of the city transport management improved collaboration, where together with the subs and the dogs and the traffic, we are in the same space in Gudud. We have, through the .P, with the additional cameras, for example, in some places like the red zones and Khayelitsha, we have additional cameras that have been installed there. We also cooperate with the neighborhood watches together with the Department of Community Safety, where we participate even in the provincial joint operation. Remember, our core business is to render health services, but now we see ourselves that now we're in the space of security and safety. And we've signed a memorandum of understanding also with the City of Cape Town to this effect. Now to the finances, Deputy Speaker. Health has the largest footprint in the community. We provide health services to 75% of the population, 24 hours, 365 days a week, from the unborn child to the oldest, which is from the cradle to the grave, and this includes the deceased. So that's why for us, over the past year, we acceded to calls from communities to improve services, in particular in those pressurized facilities. From time to time, we'll keep on adjusting in case that there's a need for such. We have to this end, for example, develop improvement strategies plans for the Khayelitsha District Hospital, because when now you get all these challenges out of the blue. Helderberg Hospital, we've got improvement plan. The Grabo, recent weeks, for example, in Khayelitsha, we've opened a new 30-bed ward, a new CT scan, and we've improved the nurse governance. In Helderberg Hospital, the new EC is underway, and in Grabo, we're extending the operation hours to even including the weekends, plus also the 24-hour emergency that the Grabo will see by the end of April. There are all ways in which way to improve Deputy Speaker, I would like to commend the department for the 14-year record of an unqualified audit. Now I'm going to the finance. We've had a clean finance audit, the only government actually in South Africa to have a clean finance. Understandably, the percentage that we even we contribute towards the goods and service. I rest easy tabling this 24.8 billion budget, which is the biggest slice in the department, in the Western Cape government. In terms of the budget, in this 24.8 billion, you'll find that in terms of the budget allocations, 59% goes to staff, it's only for the salaries. 38%, it goes to the goods and services. So you can understand in terms of the stress that we wear, it's not easy even to get the unqualified audit, but we have done it. In this budget, it includes the national conditional grants, which is about 6.4 billion. I think what is important in all these programs, budget programs, there's been increase throughout from program 1 until the program 8. But you'll find that in the program 2, the district health services, which amounts to about 40% of the total vote, just to show how we are serious when it comes to service delivery. And if you look at the program 8, it's the one that has got a nominal increase for 25% of the budget, to show that the business is really unusual. We have to make it a point that the Tigerberg is being maintained, the Joste has to rise, the Swartland also have to rise, all those that were affected. In conclusion, none of this incredible work will have done without our support from the staff. Firstly, thanking the Premier and the Cabinet colleagues for giving the support. When I started here as a novice, of course, I was nervous, but they give such a support. Our members of the Provincial Parliament, the Standing Committee for their assistance. It's a pity that Member Gillon is not here, but I want to thank also Member Gopi, also I'm thankful now from the opposition who have been the shadow MECs for help. And then to the chair, Mamu Lorraine Botha, thank you together with the staff from the Parliament for giving us assistance. I think what is also crucial, I must also share, is about, in spite of the fact that when we're sitting in this, because we want to play to the gallery, but we find that within the committees, the committee does their work. They hold us into account. They ask pertinent questions. And even when they ask, because I used to check whether when they ask these lot of documents, do they read? And then you find that actually when they ask these documents, they really need to find they're actually in terms of what is needed. But what is mostly important is that they are not representing themselves at the committee. You can see that the person is talking about the pertinent issues on what is happening related to the patients in that area. So I want to thank the committees for that. Thanking over 32,000 of our staff members who are dedicated under the leadership of Dr. Beth Engelbrecht, assisted by the top management that is sitting there. Thank you for understanding me that there are more than 24 hours in a day. Your phone will never be off if mine is still on. The support from the strategic partners, private sectors, academic, the support of our community structures, my office sitting there, and the chief of staff, spokesperson Colin is sitting there, which are the wings beneath my wings. I know I'm the difficult person to live with, to work with, but they understand that at the end we're doing for the Anti-Sara and the Womhart and no Zamelas. And lastly, my family was not here. They are still busy. I just thank them for giving me the opportunity and also to understand that we don't rest because we are tired. We rest only because we have reached our destiny, of which is we have reached our destiny now. The patients still need us. Thank you very much.
Honorable Lorraine Botha.
Honourable Deputy Speaker, honourable members of the House, HOD and the Department of Health. As the chairperson of the Standing Committee on Health in this Parliament, I am trusted with the task of performing oversight over the Western Cape Department of Health. Furthermore, it is exceptionally important that I perform my oversight function in the interests of the people of this province and in a way that ensures that capacity building continues to take place in this respective department. Deputy Speaker, the demand for public healthcare services has increased significantly over the past few years, not only in the Western Cape but across the country. Furthermore, it is no secret that the current economic climate provides limited room for growth in terms of government spending across all departments. However, regardless of severe financial restraints, the capable DA-led Western Cape government remains dedicated to ensuring that Tebogo, John, Riaz, Laika, the affectionate Makumalo and Anti-Sara, and all the other residents of our province who make use of public healthcare services are not denied access to world-class healthcare facilities. In order to ensure that the Western Cape Department of Health continues to provide our residents with the necessary services, to ensure that all residents are bestowed dignity, 24.76 billion rand will be appropriated over the 2019-20 MTEF period. This budget allocation is higher than any other department and once again proves that this caring government remains committed to providing adequate healthcare services to all the residents of the province. As the Minister of Finance, Ivan Meyer, highlighted, the DA-led Western Cape government has established a budget focused on consolidation for maximum citizen impact. The pro-poor budget will assist 75% of the total Western Cape population who are unable to pay for private healthcare services. Deputy Speaker, the reality is that for millions of South Africans living in vulnerable rural and urban communities, their public hospital is an important and often the only source of healthcare. As transformation in the hospital and healthcare fields advances with the use of new technologies adopted by our progressive government, we are eliminating or at the very least reducing the risk of some communities losing access to healthcare services and the opportunities and resources they need to improve and maintain their health. Deputy Speaker, health is not simply the absence of illness, but is also more than a state of physical, psychological, and social flourishing, and includes an individual's ability to adapt to physical, social, and mental adversity. It is affected by many factors, including access to healthcare and especially the social departments of health, and its renewal is similarly multidimensional. Furthermore, Deputy Speaker, as a society and especially as public representatives, we are tasked with being the voice for the voiceless. In this regard, we have an obligation to make access to an adequate level of care available to all residents of our province, regardless of one's financial standing. In this regard, Deputy Speaker, the DA-led Western Cape Caring Government dedicated more than 1/3 of its provincial budget to providing quality healthcare services to the people of our province. It is our caring and capable government that recognizes that quality of care is a key component of the right to health protected by the South African Constitution and is significant to equity and dignity for women, children, and other vulnerable groups in society. Regardless of one's socioeconomic status, age, race, and ethnicity, or whether they are a person with disabilities, no person deserves to be denied access to healthcare services. This capable DA-led caring government continues to ensure that its residents live lives longer than anywhere else in the country. Deputy Speaker, in the Western Cape, the life expectancy for women and men is ages 70 and 65 years respectively, higher than the national average of 67 years and 61.5 years for women and men respectively. The reality is, if you live in the Western Cape, individuals are more likely to live a longer life. Taking this into consideration, Deputy Speaker, it's not surprising that everyone around the country is wanting to live in our province, where they will be guaranteed not only better healthcare services, but better services generally speaking. Unlike the ANC-led Gauteng province, where their very own MEC of Health allegedly contributed to the death of mental health patients under their care, our province differs tremendously. In the Western Cape, residents have access to as many as 52 state-of-the-art hospitals across our province. Unlike many provinces across the country, ask the people in the Northwest, for instance, when one steps into a hospital in our province, access to health services is concerned with helping people access appropriate healthcare resources in order to preserve or to improve their health. Deputy Speaker, as the caring provincial government we are, Honourable Janki, the provincial department has taken a holistic approach to how we service the residents of our province in terms of how we go about providing health care. From my analysis of the 2019-2020 budget and annual performance plan, it is clear that this Department of Health remains committed to doing the greatest good to the greatest number of people, adding the greatest value, always prioritizing the poorest of the poor and other vulnerable groupings in our society. Deputy Speaker, other health departments across the country can learn many great lessons from how Provincial health departments ought to be run, as shown under the trusted leadership of our Provincial Minister, Noma French Mbombo. Our capable state has shown the significant impact of using integrated, comprehensive strategies to reform healthcare delivery, within which vulnerable communities can make individual choices based on their needs, support structures, and their own preferences. If we are to continue to bring healthcare services to all the people, Deputy Speaker, the medical profession and the government must work together. Obviously, the government cannot achieve this objective without the cooperation of the medical profession, because medical services must be furnished by the medical profession. I believe it is equally true that the medical profession cannot achieve their objectives without the help of the government. In this regard, we are in a catch-22 in the province's current situation concerning the safety of our EMS staff, in particular, Deputy Speaker. As a caring government, we can no longer sit by and merely watch our EMF staff continue to be ambushed by criminals. In respect of these selfless health practitioners and in respect for their respective family members, without the assistance of the very communities that these health practitioners service, these respective communities will inevitably be denied crucial services, as we cannot continue to put these health practitioners' lives in danger. Also, Minister, I would like to highlight here that there are minuscule pockets of health facility personnel who serve patients with an undesirable attitudes, and therefore paint this department in a bad light. As for the vast majority of health personnel in the province, through you, Minister, I would like to use this opportunity to give them a 10 out of 10 for their tireless commitment to serving the people of our province. I would like to thank Minister Mbombo, the head of department, Dr. Beth Engelbrecht, and all the personnel that steer this department, but most specifically, Deputy Speaker, the nursing personnel, for their continued hard work, dedication, and commitment to making healthcare accessible to all residents in the Western Cape. A heartfelt thanks to the committee coordinator, Namonde Jamka, and the assistant coordinator, Mary Ann Burgess. I acknowledge that it was not always easy. Thank you for the support throughout this term of committee service. To my colleagues in the committee, thank you for your dedicated support. With all things considered, Deputy Speaker, it is clear that this budget has been drafted with the department's strategic objectives in mind, to fund its most important projects in pursuit of its stated aims and policy objectives. This budget is a responsible and caring budget. In conclusion, the Democratic Alliance therefore support Vote 6, Health.
Honourable Magaka.
Thank you, Deputy Speaker. Deputy Speaker, can I preface my speech by saying, if there is anything that doesn't need to be politicized, is health. Health in this province has been always, even since during apartheid time, has been always the best, not only in South Africa, in the continent. I'm saying that, Speaker, because I am a product of that particular system. My mom was born paralyzed, and she was helped by the doctors in Grooteskiel here, and she could walk at the age of 14. Then I take it very, very, very bad when I hear someone using politics when he deals with the health system, while our people are dying every day. I'm happy that our minister, our national minister, doesn't do that. He's very careful when it comes to health. Let me say, if there is anything we need to unite and address as this provincial leadership, political leadership, is health, and we need to accept first that we are experiencing a lot of problem in our health system. We also need to acknowledge that a lot of other challenges are more of a self-orchestrated one. The appointment of health facility boards and clinic committees is but one example. The MEC in the APP claims this was to improve the patient's voice, but in reality, this killed the patient's voice. Our hospital boards and clinic committees are dominated by DA puppets. That is why these boards never present to this House a fair reflection of our hospitals. Instead, they always try to protect the minister. The sixth administration will have to look into this problem. Speaker, in South Africa, March is recognized as a TB month. And March 24th is World TB Day. This year, it was celebrated under the theme, It's Time. It's time for a world without TB. It's time to treat 40 million people affected by TB by 2022. And it's time to know your TB status. To mark the World TB Day, Doctors Without Borders celebrated TB survivors and activists for the role they played in striving for better TB and treatment in South Africa. TB activists demand that their basic rights be respected, and they want a less toxic, shorter treatment. One of the activists celebrated by MSF was former TB patient Phumeza Tisile from Khayelitsha, who went permanently deaf from daily kanamycin injection. She was finally cured of XDR-TB in 2014 following 2 years of treatment. She was now became powerful activist for better treatment. Another activist celebrated by Nolutu Maban, also from Khayelitsha, who was diagnosed with MDR-TB in 2017 and declared cured this year. Due to her treatment, she suffered intense side effects, especially damage to her kidneys and some hearing loss. As this House, we should stand in solidarity with TB activists, or these TB activists I'm referred to, and others, and support their call for improved care and less toxic drugs. TB remains the leading cause of death in South Africa, especially among the poor people. More concerning for me is that the Western Cape Health Department admitted that it is struggling to deal with retention of TB patients on treatment. It is also struggling with retention of patients on ART in care and cannot deal with the TB death rate. Through this budget, MEC Mbombo was given an opportunity to show patients, activists, and health workers that she was serious about their plight. Unfortunately, she failed to rise to this occasion. Allow me to express gratitude and appreciation to the national government for the increased equitable share and conditional grants for this province. These conditional grants include comprehensive HIV/AIDS and TB grant, which is over 1.6 billion. Overall, the conditional grant increased to over 6.5 billion. This shows a caring agency government. Speaker, the robberies and attacks on our ambulances still persist, as the MEC referred to. On Sunday evening, MEC Mbombo shared on her Facebook page the ordeal of two EMS staff members that were robbed at gunpoint on Saturday evening in Harare. They were robbed of their cell phones, wedding rings, and other belongings, and were left severely traumatized. These are mothers, wives, daughters. We cannot continue to place their life in danger in this way. Safety of our EMS personnel is the responsibility of our MEC. and the department. The MEC has failed to come up with new and effective intervention to deal with this societal problem. I know it is not a problem of an individual, it's our societal problem. It's part of the problems of capitalism, Honorable Premier. Why is there no budget for safety of EMS personnel? Why is the MEC cannot partnering with MEC Windy to have safety volunteers in the red zone escorting EMS personnel? I think we need to find a solution. We need to find a solution on this one. We need to negotiate with the police, with MEC Windy, to find a way of escorting these people. Every time they are called, we need to find a way of connecting with the police. Yes, the community have to raise it. There's no doubt about that. But I'm saying we need a collective effort with the police. We need to find some negotiating kind of a deal to assist, to protect. The important thing is that they should be protected. We need to use all the efforts. In the APP on page 71, we see that the number of ambulances will be increased from 247 to 249. The Blue Book also shows 4.22 increase on the budget. This shows the EMS will remain under-resourced and understaffed. Out people will continue to wait hours for ambulances. The decrease in the budget for sub-program 3.2 is a recipe for disaster. To make matters worse, this MEC even decreased the allocation of EMS training colleges. I also can't think of any justification for the decrease in the payment for capital assets under Program 4. The 7% increase in the budget for this department will not have much impact on the poor people using our public health facilities. People in Kailicha District Hospital will continue to sleep on the floors and chairs. This is so because out of a budget of over 24 billion, the DA is only allocating 511 million over the 219 MT. 511 million. 500 million over 7. I'm good in arithmetic, sorry. Try someone else. Don't manage to increase load pressures. When one looks at all the challenges, what do you say? Okay. When one looks at all the challenges in our health facilities, we'll have to agree this is a set. Speaker, we are told that 27 health facilities will undergo major and minor refurbishment during this year. In the recent past, 2 hospitals make headlines in the province. The first being closure rumors of Tiger Bay Hospital because of dilapidating infrastructure. In response, over 424.5 million is allocated over the 2019 MTF. This is not enough and will not assist. The second hospital is the missing GF Jaws Hospital. The MEC must tell the people of Miningburg where is the budget for this hospital. I also have to raise my concern with regard to the decreased transfers and subsidies.
Order.
Order.
Member, your time has expired. I'll allow you to finish your last sentence, please.
Okay, let me lastly say, in the past, I complained about this province blocking students from poor background from participating in Cuba South African doctor program. To me, this represents a government that did not want to see a black child escaping the shackles of poverty through education. They have now taken this agenda to a next level with the over 14 decrease in the budget for sub-program 6.3.
Thank you, Member. Your time has now really expired.
Thank you.
The Honourable Minister to respond. In the absence of the EFF and the other small parties, the Minister is next. Sorry, Chief Whip.
Speaker, I again rise to raise this side of the House as grave concern at the absence of both the EFF and the ACDP in fulfilling its constitutional roles.
Thank you, Member. It's noted. The Chair also noted that. Minister Mbombo, you may respond.
Thank you for the members for their input. Standing Committee Chair, thank you also for the contribution you have made, especially regarding to the staff attitude. As I always make an example, if you have got 33 staff members and you have got over, I don't know how many millions, but in the primary healthcare facilities, you see about 14 million head counts. I'm not including any other. We don't expect that all the people will have the same kind of an attitude. Just like a bag of apple, you'll always have the rotten one inside. But what matters is about how to make people account. How do you throw away that apple, to identify first that apple so that it doesn't spoil the rest. It takes one matchstick to burn the whole forest. Hence, we have got things in place in measurement. I made an example of the patient's voice. I think the member alluded to. We do use hotlines where people, even if they don't have the airtime, they can use their phone to call the police call. We do make use of the clinic committees, which I'm going to respond to, the hospital boards, as the members of the community, because we change it completely. It's no use to appoint someone to be a board who's not utilizing that facility, who doesn't understand what is happening surrounding that facility. So they become the eyes and the ears. So that's why even we've got the layers and layers of the processes or structures where people can be able to raise these voices. For example, I've made an example of the independent health committee and so forth. So we will be able, and one of the other things about is crucial, like when everyone has got a name tag, including myself when I go to the facility, so that you can be able to identify the person who has wronged you, so that immediately we can be able to do something about it. It's true, member, we cannot politicize health. It's too important to be reduced to the political football. But as you go along, I think I need to respond to all of those. The appointment of the clinic committees and the hospital board, 2016, when we passed, we reviewed, we amended the original to 2001 Act, where we said now we need to go beyond the hospital board, plus also the facility, plus also the clinic committees. In the clinic committees, in all of those, all the adverts have gone through where anyone can apply. It doesn't say you must wear a T-shirt or you must have a membership. It was open to everyone, to all the community newspapers, to all the national newspapers, to all the radios, and so forth, one. And then number two, we even extended, when we didn't get much of the responses, we even extended it. Number three, we've put in every facility for the people to apply. I'm talking about the clinic committee specifically, to apply. And then fourth, the standing committee also were given the task that if they know of anyone who do want to apply, they can apply. So the people who have applied is the people that they responded to the call, not to the Mbombo call. Now, with the hospital board, it's in the Act, the standing committee has got a responsibility to appoint the members of the legislature that have been recommended. So for that one, we haven't done any appointments. What's supposed to happen is that you're supposed to fulfill all your community members. So we have done that. So what the member is saying that doesn't have evidence. Now let's move, is politicizing. You said you mustn't politicize. TB, the 24th of March, in terms of the TB, I just want to thank you for highlighting the TB ambassadors, specifically the local ones. Probably maybe to add also the Miss South Africa is also part of the Tareen from PAL, is also part of the local ambassadors and all those. And it just gives a confidence to the people to show that TB, anyone can have the TB. Our doctors, even themselves, that's why we have got that thing that says behind the mask, we are all the same. Even our doctors also have got suffer from the TB. Everyone, as we know that Tatu Mandela, Tatu Bishop Tutu also suffered from the TB. And in terms of the raising awareness, in the past you might have seen that we have opened the windows in the taxi rank. We have been into the trains where we're creating such an awareness. But what is different for this theme, which is an international theme, it was about where now you mobilize the religious leaders, parliamentarians, the legislators, and then for us together with the national government, hence we have done it at the cathedral this time around. So we were there. Both departments have worked around that because we don't politicize health. We work together. In terms of the grants, I did mention that actually the whole of our budget, whilst we acknowledge the increase in the program 8 related to the infrastructure, but the whole of our budget, it doesn't talk to the real what is happening in terms of the population. Probably I must just take some time to explain this. 2011, we had about 5.3, now about 6.7 million the people. In terms of the formula that is being used at the national level, which I've raised now and again, called Tembisa model, it looks in terms of the number, counting the number of the population. And then in that number, they check which ones are insured and uninsured. And then now they allocate. I'm talking about the equitable share. Now, if there have been an increase in number in Mpumalanga and an increased number in the Western Cape, you find the similar, same kind of allocation because it's based on the quantity. But it doesn't take into consideration that with the Western Cape, because we've got central hospitals, in Mpumalanga they don't, there people might be only coming for normal chronic conditions, communicable or non-communicable. But in the Western Cape, we talk about the injuries, the traumas, personal violence, where, for example, it takes about 25,000 per person in terms of the issue related to the trauma. In the ECs, they talk about the battle medicine, where now it's like when the people come with the 8 bullets and so forth, it's like it's in the battlefield, where it takes more, not only resources, but they actually everything in terms of impacting on those who have to wait, where now they have to undergo these surgeries. So that 200 rand that per person has been allocated as an additional by the national versus that 200 allocated to Mpumalanga for that additional person. It doesn't talk to the same thing because this one, you might get some of the chronic medication which is far cheaper compared to the amount we pay for that additional one because related to the interpersonal injuries and trauma. So the budget, it might look some like big, but in real terms, it's not. Actually, we've got 187 shortfall in the budget. It's because the allocation of the budget is being politicized. It's being politicized. Even with all of these grants, they're being politicized. Western Cape talk about the retention. We are the ones who have got the most number of the people in terms of being retained in the ART program. We do have such. So whilst we might have the lowest HIV in terms of the incidence, of course, in terms of the prevalence might be high, but the issue, like you have mentioned now, is about the issue of the TB. Previously, we used to be the highest in the country. But Western Cape, Eastern Cape, and the KZN, from the 2015 figures, actual KZN is the highest, followed by the Eastern Cape, and then the us. But the issue, of course, for them, specifically the KZN, the issue is about the twins, the HIV and the KZN. And we must also acknowledge that it is now coming down because now they are very vigorous when it comes to medical male circumcision. What is different in the Western Cape, as I say, that we've got the lowest HIV, is about some of the contributors that related to the loss for follow-up because of the seasonal workers come in, come out of the country, and so forth. But also, it's still a challenge related. It's an academic exercise because the researchers still have to find out exactly. But the mere fact that we have got one of the highest TB treatment success rate. So it means that when people are diagnosed, we make it a point that they take their treatment and they get cured. That's what matters. It means they don't affect the all others. But with the issue of the mobility, people coming in and out of the province, they ended up losing them in terms of the follow-up. But we'll talk those in my lecture 101 sometime. And then with the issue of the ambulance, I think the member has indicated that it's a societal issue. It needs everyone, the whole of society. But what pains us is that it's the same people who need these services most are the ones who are also doing this thing. But again, we're not saying that specifically, there's no evidence that they are specifically targeting the EMS. We have seen police in the police van where they're being targeted, like in the garage. We have seen in the police station where the police, they've got actually the security that are guarding them. We have seen where even in some instances, for example, even in the highways where they are not necessarily in the road zones being attacked. So it's a reflection of the safety concern that is happening throughout the society. But the EMS, they are becoming that targeted because they are the ones where everyone knows that in that vehicle, there will be medicine. In that vehicle, there are only 2 people. So therefore, they become soft targets. But what matters is about how we have managed, especially now to make the point that people pay for this. Instead of now reporting that they've been stolen phones, they've been attacked, and then it vanishes. But we have made a point, making a case in the courts where people now ended up being, when they're being convicted, it becomes a heavy sentence that to show actually it's not about to attack this person, but it means that we have impacted where Auntie Sarah now cannot be able to get this ambulance on time, managing the priority 1. The issue of the escort, all the red zones, working with the police, probably maybe you didn't hear me, maybe the speech was already prepared, so you didn't want to delete when I've mentioned. We do have the plan. We do work with the police, hence we know through the intelligence in terms of the red zones. So they go via to the police station, they are escorted. But in some cases, once we have seen, for example, in the Gugulet and so forth, where they'll be escorted, but when they enter inside, that's when actually they are being attacked inside. So the safety plan has been there. We work with the police. I mentioned the prof joints and whatever, all of those. So the member must just go probably in the website and check our safety plan. Again, in terms, yes, I think I want again, lastly, just to thank everyone. It was good working with you. Thank you for the standing committee and thank you for everyone. Thank you for the department. Thank you.
That concludes the debate on this vote. Business will now be suspended. Order, order, order. Business will now be suspended until at least 14:15. The bells will be rung to indicate the resumption of business. The House is suspended.